Red dust on my sandals, still I walk in grace. Face to the sunrise, tears drying on my face. Beautiful ashes, I'm rising from the ground again. Dancing through damage, my broken heart.
Welcome to another episode of Beautiful Ashes with Auntie Mercy. Last week we had Evangelist Brian Chishimba, who was explaining to us and sharing with us his life experience of alcohol addiction, drug addiction, depression, academic setback, divorce, and unemployment. We have Evangelist Brian Chishimba with us once again to discuss with us further on the treatment and the causes and how most of us can be helped out there with the same situation and even other situations. Good afternoon, Evangelist. Welcome.
Thank you, Aunt Mercy. Good afternoon, and also good afternoon to viewers and listeners.
It's good to have you back in the studio with us with your very interesting story.
Thank you very much, Aunt Mercy.
Yes, last week I remember that when we were having the discussion, you mentioned that mental health, drug addiction, and alcoholism is actually a sickness. It's a sickness of the mind. And so today I would want us to look into that area, since you said it's a sickness, and we find that in our society, people will stigmatize, even in families, they'll say, oh, ichi ni chijanki chabe, ichi ni chakolwa. How can we help such people? The stigmatization, the challenges that they have. Is it proper to condemn them in such a way? Because it's like we are sentencing them to condemnation as if there's no hope when we see them continually going down the same road. What can you say to that?
Yeah, thank you very much, Auntie Mercy. Yeah, first and foremost, is accepting and understanding that addiction is a disease. It is a very good one to break stigma. So how is it a disease? World Health Organization defines addiction as a chronic relapsing brain disorder, which characterizes one with compulsive alcohol and drug seeking despite adverse consequences. So what do I mean by this? When we say chronic brain disorder, meaning the brain is affected by alcohol and drugs.
Yes.
How is it affected? The brain has got structures, many structures in the brain, but specifically I may talk about just maybe 1 or 2, 3 structures which are affected. There's a structure in the brain, of course you don't even need to know its name, it's called basal ganglia. It's the one which is in charge of motivation. Whenever you do a good thing, you are motivated. For example, if we are given Nshima at 13 hours, we get motivated and would want to start looking forward to eating Nshima again the following day with a nice relish. So the brain records that and say, this is good. We need to be doing it every day. So the other part structure of the brain, which is the amygdala, you don't even need to know its name. It's in charge of, it's a mood center, emotional regulation. So it will wait for such a particular event to happen, that good event. For example, 13 hours, it will wait for that 13 hours to happen. Then when that happens, it will feel good because your mood will stabilize. Failure for that event to happen, the structure in the brain, which is the prefrontal cortex, which is in charge of decisions, will be affected and will say, let me go and look for food. So you go and distill. So what I'm trying to explain is the simplest physiology, that the motivational centers are connected to the mood and are also connected to decision. So however, alcohol and drugs, they also go in the same pathways of the brain and they produce a lot of dopamine. So once that dopamine is produced, an individual feels very happy, and the brain records that this is very good. We need to be doing it every day. So, and failure to do it, you enter into a state which we call withdrawal syndrome. And you start making wrong decisions. That's why you see these people who abuse alcohol and drugs, they steal, not because they want to steal, because they are compelled to steal, because they are failing to withdraw. So they are stealing to continue the abuse. So in short, it is a brain disorder in the sense that the motivational centers of the brain are hijacked. What motivates you? For example, if buying a suit gives you good motivation, it's better to go and drink than buying a suit. If going to school to go and get a degree gives you it's better to drink that school fees than doing school, because alcohol and drugs are producing excess dopamine and they give you good motivation. So the brain gets sick in that state.
Okay.
So the same way kidneys, the same way lungs, the same way liver gets sick, is the same way the brain also gets sick. So anyone who struggles with alcohol and drug addiction for a long time is at risk to suffer from what we call a chronic brain disorder. And this is a disease. It's not only me, it is World Health Organization. They have categorically stated, even in the treatment manuals which we use, there's a treatment manual which we call DSM-5, Diagnostic Statistic Manual, which we use. It also highlights that this is a disease. Ministry of Health manuals, they highlight that this is a disease. So it is a disease, and once you accept that it's a disease, then you understand that treatment should also begin with the hospital, and you will not stigmatize people who are struggling with alcohol and drug addiction. You will not just look at them as moral failures.
Yes.
Yeah.
So in relation to that same motivating factor that is there, so what you're actually saying is that it's important for families, for people around, even friends, even in the community, to actually not look at the person as a failure, to stigmatize them, but to encourage them to come out of that situation. But if, let's say, in families that are living with people that have this weakness, how would you advise them to relate to such a person?
Yeah, for example, Aunt Mercy, when you hear somebody who's got a brain problem, especially in our African context, we think they have been bewitched. We think it's demons. We always think these people, but we forget that the brain is it's an organ which is part of a human being. For example, if someone is suffering from hypertension, we go to the hospital.
That's right.
And at the hospital, they are treated. And they come back to the church. We pray for them. For example, here I am. I'm a pastor. You're looking at me as a pastor and a powerful man of God. I was testifying about my testimony concerning my HIV status. You see, I've prayed to also become negative. But every time I test, I find that I'm still positive. So what do? I continue taking IRT treatment. So does that make me a lesser pastor because I'm getting medication? No. So it is the same. When a person is suffering from a brain disorder like addiction to alcohol and drugs, you pray for them, then you take them to the hospital. That's the beginning of treatment. Yeah, that's the beginning of treatment. Let's not stigmatize them. Let's not think. That's why you discover, Auntie Mercy, that here is the patient. He will come to church today very drunk. They pray for him. A week later, that person is sober. 3 days again, drunk. So you start saying, Tewiba peperele badia. Ali nena kwa TB Joshua. Ali nena kwa Shad. But now you are forgetting that this is a disease. Just like people, in fact, in the church setup, we have many people who are suffering from hypertension and diabetes. They are on BP medicine, but they come and pray, speak in tongues, very powerful. So it's the same way we should also look at addiction. Once we start accepting it as a disease, we accept it as a disease in entirety, then we have fixed the problem. We are not going to condemn, we are not going to stigmatize, but we'll approach it with a way to help somebody. Now, however, this disease has symptoms. For example, the symptoms of malaria. You go to the hospital, when the doctor wants to diagnose malaria, he's going to say high fever, I'm vomiting, I've got diarrhea. For example, if diabetes, they will say I'm feeling thirsty, I'm urinating frequently, I'm feeling excessive anger. Then you say, I think I'm querying diabetes. The symptoms of addiction, however, can only be seen through behavior. Remember the definition of psychology. Psychology is the study of the mind, isn't it? Right. But as scientists, we don't define psychology as the study of the mind. We define psychology as the study of mental processes and human behavior. Because what is in the mind can only be seen through human behavior. So when addiction has caused damage to the brain, the symptoms can only be seen through behavior. So the symptoms of addiction are stealing, arrogance, insults, that behavior which unwanted, which you don't want. So that is why it is difficult. That's why you find people saying, hey, you, stop that. No, the brain. In psychology, behavior is as a result of the biological makeup of the brain. Because if the brain, that's why even sometimes I want to give this example so that people can understand it nicely. When you swallow food, when food reaches this part, which we call the pharyngeal stage, as it is supposed to go in the stomach, you have no control. It is the brain now which needs to give signal to the esophagus to start those peristaltic movements so that the food can start moving. You have no control. That is the same way the brain when it's affected. A human being will not have control, but they will be compelled. Impulse decision, because the brain is not coordinating well. The neurotransmissions have been affected. So you find umuntu achikalafye alileka ambokunu chilisha, the brain is damaged. And science has proved that. So once we accept this, then we are not going to look at the people we so-called at junkies or what. By the way, I don't love using that term junkies, because I was also one of them, and at one time termed the junkie, but was struggling with alcohol and drug addiction for a period of 14 years.
Yeah. So when we look at it traditionally, I remember in the past, even growing up as a youth, where kwale balimo they say umuntu nganapena ni kumumangirira chabe kumukwapula mukamumenya ushiru alafuma. And sometimes you would find they've tied someone down, they are holding them down and they're beating them, pusana, and some would even say awe ngamampero yumuti some roots and everything usiru uzaenda uzasira. And some they lock them and isolate them in a room figure. What can you say about that?
No, you don't. Mental illnesses, you don't treat them with the punishment. Because, for example, let's look at the brain. What are the functions of the brain? The brain has got what we call involuntary and voluntary functions. The way we are discussing, it's as a result of how the brain is coordinating. If today I start moving backwards. It's as a result of how the brain is coordinating. So there is a structured intervention which must be carried out to treat mental illnesses, including addiction. And this structured intervention, we call it in treatment model as the biopsychosocial treatment. What do I mean by biopsychosocial treatment? I mean, biologically, you treat. So, for example, if a patient is struggling with alcohol and drug addiction and they want to withdraw, you take them to the hospital so that the body can be helped. So how do they help the body? They will give this patient some detox and also some muscle relaxer and also medication to at least sleep, medication for appetite. So the body is now being contained. Then now you bring what we call psychological interventions. What are psychological interventions? Now you start working now with the thoughts of a human being, feelings of the human being, so that they produce a good behavior. Are you aware that what you think is connected to what you behave? For example, if you are always thinking that, I give this example, you are always thinking that whenever your spouse goes out, he or she is committing adultery, how are you going to be feeling? You'll be feeling sad. When that spouse comes back, you feel very bad and you want to fight them. But yet, whatever you are doing, you're just thinking there's no reality there. So when you, at that point now, we start now bringing, there's a therapy which we call cognitive behavior therapy, which we are now going to employ to start now changing the thoughts and bringing them into positivity, so that a human being is able now to become positive. For example, me, whenever I quarreled with my spouse, I would go to drink. But now, because the thoughts have been aligned to positivity, I have understood that when I quarrel, this time I need to kneel down and pray. So I'm not going to go and drink. That is what we call psychological intervention. So under psychological interventions, there's motivational interviewing, there's cognitive behavior therapy. We understand the cognition, and trauma-focused therapy. Some are traumatized, and research is suggestive that everyone who has struggled with alcohol and drug addiction is as a result of trauma, either growing up without parents, sexually abused, or not growing up very well, childhood trauma, punishments. So they are traumatized. So they need to be helped. That's what we call psychological interventions. Then now we go to social intervention. Social intervention is now what needs spiritual intervention. It's under social, because social activities, church, the family must be taught. For example, you bring to me a patient to come and be treated from alcohol and drug addiction. Then after I do the treatment, I bring back the patient to you as the family. So as long as I have not trained you on how to handle this patient I'm sending back, you will be the first trigger to relapse. Because you will not understand. You'll be looking at this person, one eye as a person who has changed, the other one, you're also remembering the old things. So you trigger this person to relapse.
So if you can just hold that thought, we shall continue when we come back. Viewers, please stay put. Don't go away. We shall continue and explain further on this matter. Welcome back. We continue with Evangelist Brian Chishimba, where we ended off. So, Evangelist, with what you were explaining about people having a social aspect in the recovery, that it's important for them to be in an environment where they will interact with others. And you mentioned the like for you, you said you pray and you go to church. That is one area that has helped you. What other things can people do apart from just going to church? What other social environments would you advise?
Yeah, thank you very much. So the one, you need to understand what triggers an individual. So this is what we call individualized treatment. So what is working for me cannot work for another person. So every person should have his or her own relapse prevention plan. So every person must put up a certain relapse prevention plan. For example, for me, what my relapse prevention plan was, I want to marry, then go to school. Someone will say, I first want to go to school and marry. So if I chose to go to school and marry later, I could have maybe gotten stressed. Remember, mental health, the definition of mental health, according to WHO, it is a state of well-being. A state of well-being in which an individual realizes his potential, be able to cope up with daily stresses of life, and be productive and also contribute positively to the community. So there's an aspect of realizing your potential. So how can you realize your potential? You can realize your potential through avoiding those triggers. So for example, if going to the bar is a trigger, don't go. And of course, we recommend don't go because you are in a treatment. Don't go and watch soccer. No, I've just come to watch soccer. You are getting. Yes. So it's not that only church, like for me, I go to church. Others will say, no, we don't want to go to church. And by the way, going to church is the best treatment you can ever receive. Because when you are in God, we are saying, you have been treated in totality. Forget the former things. The new has come. That's you are now a new creation. So in Jesus Christ, there is no relapse because you have been changed and transformed in totality. However, science says there is relapse. So science has limitation. Medicine has limitation. But when you incorporate the two, then you have a positive change. So everyone has got a different structured plan on how to. Some do exercises, some they go to the gym. Yes, you start. Some they now just start making sure they don't miss meals. Some they want to sleep 8 hours. Those are relapse prevention techniques designed for each individual.
And when someone relapses, there's a tendency, okay, someone will see now for 3 months, then when they go back, sometimes even if they went to church, they were prayed for and they stopped for a while. There's this tendency of people saying then it doesn't work. Is there a permanent solution for this drug and alcohol addiction? How the recovery, is it temporal or it's permanent?
According to medicine and the recovery principles, this condition, you now live with it. For example, I am 9 years, 10 months today, 24 days, alcohol and drug sobriety. Why am I counting? I am counting because at one point I was an alcoholic. So I should always remind myself that today if I take, I will relapse and God forbid. So the condition itself, I'm going to give this very good example so that maybe you are going to get it. For example, here is a person who has been sexually abused. Now this person because she now suffers from a condition which we will call maybe post-traumatic stress disorder, which has come as a result of the sexual abuse. Then they are brought to me as a mental health clinician. I employ my learning principles. I treat this patient. Now this patient gets better. Now the question is, have I removed the sexual abuse? So the condition is there. So in medicine we call it, this person has just remained in a remission, a state where symptoms cannot be seen. So you have the condition, just like hypertension and diabetes. So you still have the condition, but you are just managing it. So that's the same with addiction. You still have the condition, but you just manage it.
What about those families where you find, I've heard of situations where you find that ata usiri uyenda mfamily, uli mfamily mwao. And then they can even point where a grandfather or an uncle or even a brother in a family, you find there are a number of people that have had the same mental health issues. What can you say about that?
That is
because
very...
they're saying it's like it's going in the line of the family.
Exactly, that's very true. When you look at etiological factors, etiology is the study of the causes of these diseases.
Okay.
So one of the causes of mental illness is genetic predisposition. If your father was an alcoholic, your children, the children are likely to be alcoholics. So there's a genetic trait. So psychiatry and research confirms that you can inherit the gene of alcoholism and drug and to be an addict. So even mental illness, if you, for example, one of your parents was suffering from schizophrenia, bipolar, or even hyper. That's why when you go to the hospital, Aunt Mercy, there's what we call, they'll ask a question. Is there one in the family who was suffering from diabetes?
Yes.
Is there anyone suffering from hypertension? Any mental illness? Yes, because they want to know what has caused this patient to be where they are. So in history, taken in medicine, we are very, very, very sensitive to understand the family pattern of illnesses.
How can someone that is coming from such a family where there's that history, how can you avoid you've mentioned bipolar, how can you avoid the alcohol, getting into alcohol addiction or drug addiction?
Unfortunately, especially for genetic predisposition. For example, if we are looking at mental illness as a broad spectrum, for example, if your father was suffering from schizophrenia, then you also inherit that gene and also suffer from schizophrenia. So you have no control. You see, you have no control. So, however, for addiction, the trait is dormant. So you have it, but it's just waiting for an opportunity for you to start drinking, then you get addicted. So genetic factors, you have no control. That's why we bring them, especially when we come to discuss faith-based intervention, we bring them now to spirituality, where we break all those generational cases and what, yes, so that you remain complete and, yes, otherwise, something which you have inherited from your parents, forefathers, you have no control. Medicine agrees that you can inherit conditions. Yes.
But don't you think that also would be an excuse for some people, not necessarily that it's genetic. There are people who are just coming from homes where the environment, there's a lot of alcohol, and they see the consequences, the negative consequences of the alcohol. But then they also choose, and when you speak to them, they'll say, after all, me, I come from a family. And sometimes it looks like just an excuse for someone to behave badly.
That's why when we look at the causes of alcohol and drug addiction, they are also, again, biopsychosocial. So one is biological, genetically. The other one is psychological, if there's a mental illness. The other one is social, where there are now bars, taverns, tuntembas in our homes. So, however, when somebody is in addiction, they always look for excuses. It's a symptom, not to accept the condition, but to give that, no, I think the reason is this. So everyone, most of them who are in addiction, they don't want to point at alcohol and drugs as the real cause. They always want to point at other conditions. Why do you drink? Njala. Why do you drink? Yes. They don't want, they want to, everyone wants to shield that because that is the thing which is giving you motivation. Because once it's taken away from you, you feel empty. So you'd rather protect it. That alcohol and drugs are not the cause of my problem. I drink because of other problems.
Okay.
Yeah.
So how do you handle such patients? Since you're in the field, how do you handle such kind of patients who come in with excuses and things like that?
Yeah, it's a process. Treatment of alcohol and drug addiction requires perseverance, patience, and it's for long term. So you continue giving them structured intervention, psycho education, start teaching them about this, give group sessions, individual sessions, start talking about it until they realize. For example, I would give somebody an example of myself. I would say, look at me. I failed to finish my degree at Copperbelt University because of alcohol. One. I got suspended because of alcohol. At one time, I was remanded in prison because of alcohol. I lost employment because of alcohol. I got divorced because of alcoholism. So now, even if I knew that these are the things, but I continued to take. So not until I realized that this is a problem. And then I started becoming sober. Then things started working. So you share such examples, such understanding, until a person reaches at a point which we call a point of contemplation. Because mostly they'll just be at an ambivalent stage. So now if I make this position, if I become sober, how people look at me? How am I going to live? Yeah.
I once met someone, a young lady who was brought to me for counseling. And as we spoke, I found that she was saying that she had reached a level whereby when she was high on the weed, that was now had become the normal. And she said that when she's not high, she didn't feel comfortable. She didn't feel like she wanted to live.
Yeah.
So now that state was the state of the normal. Things had turned around.
Yeah.
So for families that have such kind of a person in the home, how would you advise them to treat such a person?
They should first accept that this family member is a patient. After accepting that this is a patient, and understand that treatment is long term, takes a longer time. 3, also understand that the behavior may be undesirable. 4, bring them now for psychiatry intervention. Either take them to Chainama hospital or any other hospital which has a mental health department, so that they can look at the patient with structured interventions. Yeah.
Okay, all right. What other protective factors can families and communities strengthen to prevent young people from developing substance use and related mental disorders?
Yeah, thank you. So these are because the key is prevention, because treatment is expensive.
Yes.
Let's invest in prevention. So how do you invest in prevention? One, we should know one good protective factor is to also study schools. The schools where we are taking our children. That school, what values do they have in that school? Is it Christian values? How the teachers who are found at that school? Because the child who is in school is going to learn the language of the teacher. For example, if you understand the developmental stages of children, it begins from the child is being taken at 1 year. Do you know that when a child is 1 year old, and the child is crying for milk or anything, then you don't give that child. You are making this child getting trauma. At 1 year, the child will be traumatized, start thinking like this world, there is no hope to survive. So the child will suffer from hopelessness in the future. Yes. So it matters with the caregivers we bring to our children.
Yes.
The maid we employ, they don't take care of the children. That's trauma as well. So as we are taking these children to school, we should also understand, because a child now, as the child is growing, what the parent is saying is what the child is going to agree in.
Yes.
So even as parents, the language we use, how we behave at home, how we take care of our children, the insults, we should stop insulting. Oh, rich puba,
Yes.
mwana wa 4 years. You're traumatizing that child. Mwana ale akula brain ile start develop.
Yeah.
You see? So we should know. Then the school we take the child to, the teachers, what language, how do they treat? Then the friends, who are the friends as the child is growing? Who are the friends? Those are protected. So as parents, we should strategically be positioned to look at that. It's very, very important. Yeah.
All right. That's very good advice. That's very good counsel.
Thank you.
I didn't think of it that far back. And I'm amazed to find that from the age of 1 year old,
Yes.
the trauma registers in the brain.
Yes, as long as, in fact, the brain starts recording just right there in the fetus.
Wow.
Whilst it's in the it's already when it's still in the fetus stage, the brain starts also recording every activity. When the child comes out, the child, when you, in psychology, there's what we call Erik Erikson psychosocial development at every stage. So for example, 0 to 1, whatever you do, a child can get fixated and suffer hopelessness. At this stage to this stage, a child can suffer not feeling like they're not loved. At every stage, there's a fixation if not handled very well. It's called child development.
Yes. So pregnant mothers must be mindful of what
you are pregnant and you are an alcoholic. Your child can suffer from fetal alcohol syndrome.
That's right.
Yes, which is a condition also. You see, there are many conditions which a child can suffer from as a result. Yeah.
How do you integrate? You're talking about being a pastor, and you are now a professional mental health personnel. How do you integrate faith and spirituality with clinical psychiatry without compromising scientific treatment principles?
Yeah. So number one, I believe the more you study, the more you should appreciate God, the existence of God. That's my belief. So even science has got limitations. For example, treatment to diseases like addiction, they are ongoing. Yes. But when you bring faith, so I understand that faith and science are two different dimensions with a different measuring units. For example, if I ask you, Auntie Mercy, 5 newtons, or maybe just a simple question, 5 kilometers plus 5 kg, what's the answer?
5 kilometers plus 5 kg. Those are two different things.
Yes.
How?
So even myself, I have understood that I am 2 in 1 and I should not bring them together.
Okay.
So where science is, it's science. Specifically, if it's mental health, it's mental health. Where it's time for faith, it's faith. So I'll know at the time. So I'll ask, if you want prayers, come home, we pray. If you have come at our psychotherapy center, it's strictly you have come for psychotherapy. Yes. Okay. So it's time for prayer, it's time for prayer. Yeah. Because once we start, yes, but they should work together and complement each other. Okay. Yes, they should complement, because once you do biopsychosocial principles plus spiritual intervention, that's a good holistic approach to treatment of mental disorders.
So, in your faith-based counseling, what percentages are you seeing? Of how are the percentages of relapses?
Those people who have changed and have incorporated faith-based intervention, I can safely, although I've not done any study, but from observation, I can count 1 or 2 and say at least 90%.
Okay.
From observation, I can safely say those who have incorporated a holistic approach where they have recognized the higher power, specifically Jesus, 90%. They will remain in lasting sobriety for years. But those who say, no, we don't need God, usually they relapse. Yeah, the risk of relapse is high.
It's very high.
And there is a research I was reading, it's even evidence-based. I may just not have the numbers, the actual figures. But from observation, I can safely say you need one person, one individual must blend in, incorporate faith-based intervention with scientific principles.
No,
That's why even the books I've written, you can see there's a true life story,
Yes.
there's a medical approach, and the faith-based intervention. So faith-based intervention also should be handled. That's why we need also to talk about it in totality and also understand how can one move in, especially in addiction. Testimony sharing. Yes, different,
Yes, just like you're doing now,
Yes.
you're encouraging
Yes,
us with
every
your,
day.
with your story.
Yes,
And you're
and-
counting the days of sobriety and the years.
Yeah.
Yes. What message would you give policymakers, church leaders, employers and health institutions about treating addiction as a medical condition rather than a moral failure? Because I hear it, even in certain churches, you hear certain messages that are preached and people are being castigated, drunkards, you go to hell, and things like that. What message would you put across to them? I definitely have heard such messages.
Yes.
Where they're told drunkards will not inherit the kingdom of God. Even at funerals, you hear such messages being preached. So, what message would you give to such?
When you look at, especially if it's to look at the theological understanding there, when Apostle Paul was writing to the Corinthians, you can see that that message meant, it was specifically to the unbelievers, those who don't believe. That don't you know that drunkards, because there is an expectation that in the church we should not have drunkards. So drunkards, usually they are unbelievers. So the Bible tells us again, a righteous man shall fall, and 7 times shall we rise.
Yes.
So there is an ability. There's somehow we can say someone can still fall and still rise. So we should blend in this and understand that this is a condition and it requires treatment. Quite as much as we are looking at them, because if we use in fact the church should be a very good solution center. So we are in fact calling most of the churches to even invite people who are trained like me, so that we train leaders in the church, those who want to help people who are struggling with alcohol and drug addiction in the church, be it praise leaders, deacons, even pastors. Some struggle with alcohol and drug addiction. So we train on how to handle them, because if you've not handled them well, you will never help them.
You are a living testimony of 14 years of drug abuse, alcohol, even attempted suicide, and your story is touching many people out there. And therefore, my question is, as you are now at this place where you so seemingly have overcome, you've managed, and you're saying it's day by day, one day at a time. would you advise even the faith-based people in the churches to have specifically programs, like you are saying, that will cater for such? Because a number of times I know that the church is like a hospital.
Yeah.
You have people coming with different kinds of problems, especially nowadays. You find 3/4 in the church, they come to God because they have problems. Amafya yengi panasonde. So nomba abantu abaleisa nama conditions ayo, and for you, you've even said with HIV and AIDS. So what would you say to the church? Should they have specific programs that are targeting and looking at this situation?
Yes, too much.
Rather than even Jesus said, I do not condemn you, to that woman who was caught in adultery. He says, I'm not condemning you.
Yeah.
I've come to help you. What can you say?
Yeah,
to
it's very important for the church to have structured programs, especially invite. That's why, again, I would say invite professionals. Don't just start a structured program because you have pastors who are very spiritual. No, invite trained people so that you blend in together, so that we give that knowledge, the same knowledge we are from sharing.
Yes.
It needs to go to the church now in detail. You may have a 1-day workshop, 2 days, 3 days, 5-day workshop, and people are able now to have maybe you can call it even a care center, where people are coming there, they are freely able to share that this is what I'm struggling with, and they know that when I go there, at least I'm going to receive help. And one thing why people hide, especially to reveal that the problem is alcohol, because they think like, even if I tell you, where is the solution? So, but if you have a structured way where you can point, the solution is here, people are able to open up.
There are churches where they actually discourage divulging when people have a problem. They'll to go even to the hospitals. They'll tell them, we've prayed for you, and so you don't need even to drink medicine. Msazienda mukampereka ku China man pamene azafuntira atu uyu kuja kulima demon yeka.
Such a church must shift to heaven quickly. Because as long as you are on earth, yes, because that church is acting spiritual now. So they should go where spirits live. Because as long as you are a human being, you need to be attended to. You need to eat, you need to bath, you need to go to the hospital, so that your body is taken care of.
That's right.
So there's a time when we'll be spirits in heaven. That's when we'll stop looking at it. So that's why I'm saying that church must shift quickly to heaven, because they are not understanding. So such a church needs information. They need to be told that taking medication is an act of faith. It's not something like, in fact, sometimes when I've also encountered, I go to a church, I find the pastor, after testifying about my HIV status, pastor will lay and I cast down, you're wasting your time. Because I'm not even complaining. I'm happy. And I've understood that there is a certain reason, because God himself knows. And my taking medication, it's working. Yes. So taking medication is not demonic
at all. And even amongst the disciples, we see there was Luke. Who was it?
A physician. Yes.
So I think if God didn't want us to have the conventional medicines, he would have taken on even a physician like Dr. Luke. So thank you very much, Evangelist Chishimba, for all this information that you've given to us. And I look forward to discussing further, so that you can enlighten us and you can help us. And thank you even for explaining and merging the faith and the science together, because some people are strictly science and they'll say, no, as long as it cannot be proven scientifically, we can't take it. But here you are as a testimony telling us, and now you are even a professional medical person. So you've blended things so well and you've clarified. So viewers, this is what we had for you today. Until next week, it's Have a wonderful time.
Red dust on my sandals, still I walk in grace. Face to the sunrise, tears drying on my face. Beautiful ashes, I'm rising.